There you
Hello,
go.
everybody. Hello, Dr. Kirsten. So happy to have you here with me
Hi.
today. And while I'm going to be looking at my screen just for a moment as I try to go live on Instagram as well. All right, I think we are live every
Yay.
place. Woo! YouTube,
Thumbs up.
Instagram, Facebook, and maybe LinkedIn. We'll say maybe. All right, guys. All right, so we're going to go ahead and get started. Hello and welcome to Live with Leslie. I'm Leslie Bytel, and I'm genuinely delighted to have you here with me today. And I'm really excited to be back into our regularly scheduled shows, our live shows from here on out. After taking just a little bit of a hiatus from our live streaming to work on the Freedom from the Grind Summit. So we had a lot going on the beginning of the year, but we are back in the saddle now and ready to come live to you every Thursday. So, what I want to do is introduce our topic and our special guest. So, today we have the pleasure of talking with Dr. Kirsten Grove, and she is from her business called Grove of Health. And today we're going to be talking about sugar. All right. And specifically, sugar's impact on brain health, such a hot topic nowadays. And specifically, we're going to chat about why brain fog, mood swings, and cognitive decline might be linked to your blood sugar. All right. So before we jump in, I want to welcome Dr. Kirsten, and I'm just going to spend a moment just sharing like the short version of her exceptional bio. So Dr. Kirsten Grove, a functional neurology chiropractor who helps people overcome brain fog and cognitive challenges when they've been told it's all in your head or just give it time. We're going to hear a little bit about her story as well, I want to add. So, Dr. Grove has a 7-step brain health optimization process that she has created to help her patients to optimize neuroplasticity, blood sugar regulation, brain gut access, and nutrition to help them restore cognitive wellness, mental clarity, and energy. So, a really effective program. And anyway, I am delighted to have you here today. So, I want to welcome everyone and specifically Dr. Kirsten. How are you?
Good. Thank you, Leslie, for having me
Good.
today. I
Yeah.
appreciate it. Hi to the rest of the audience out there.
Yeah.
So, yeah.
So happy to have you. This has really become a hot topic, specifically, blood sugar control and the impact really on the brain.
Yes.
So many things to talk about. But before we dig in, let's talk a little bit about the backstory. I'm always curious. I happen to know your backstory,
Yeah.
but I think it would be really important and compelling if you would just take a moment. Yeah, let's share with our audience a little bit about how you traverse this journey and what made you go from traditional chiropractic. Specifically, you specialized in more of the on the sports side of
Correct.
things,
Yes.
and you went back and got all kinds of additional training and education, specifically in neurology. So tell us about that journey and what made you move in that direction.
Yes, I was a traditional chiropractic in the sense that I actually wasn't your normal chiropractor to start. So I did a lot more sports medicine from the get-go. I incorporated physiotherapy with standard chiropractic and rehab. And that was my practice for 20 some years. So I worked with a lot of athletes, so primarily endurance athletes, but in variety, so tennis, endurance, triathlon, running, swimming. And over time, I'd get concussions, and we as a s- I have a special training in sports medicine, so I was aware of how to work with concussions, but brain function, brain what we're aware of with brain health has come a long way in the last 10 years. It's changed even from when I started. And so partly working with patients who had concussion, helped me want to get into like more aware of brain function, brain health. And then I had my own personal concussion.
Mhm.
And at the time, I was kind of aware a lot of standard medicine protocols weren't going to do a lot for me. So, true to my nature, I kind of just helped myself. Right. And so, fast forward like 7 years post concussion, I was at a sports symposium and I was having symptoms from my concussion from 7 years. So I was having some memory glitching, my concentration was off. I was still able to work and function, but just not at my level. So I knew it was off, but I wasn't really sure. So at the symposium, there was a doctor there who specialized in functional neurology. And he started describing this case of a patient who was a veteran who had had a concussion from an IAD 8 years prior. And so he had seen him and he was describing all the symptoms. And during the class, I was like, oh my God, these are my symptoms. I have
Mhm.
to talk to this guy. And so I did, and I ended up getting treatment with him. I flew to Oregon to because he was quite good at what he did. But during the course of treatment, he's like, you have to learn how to do this. Like this would be really good. So I ended up taking functional neurology seminars. So over 300 hours counting now and more to specialize in functional neurology. And it's what I like to tell people about functional neurology is standard neurology, you have your tests to see if you're really diseased. So, like if you have Alzheimer's or Parkinson's or MS or those types of things, which is great, like those very valuable. But what happens is there's this gray zone where people are starting to glitch. And if you go to standard medicine, it's not going to show up. It won't show up
Mhm.
on MRIs, it won't show up on CT. You have to kind of work in this in between zone, and that's what I tell people is where the functional neurology space kind of comes into play. So as I was doing that, and I've learned, and brain health, I really am, as a chiropractor, I was very much a proactive, let's try to get to things before they get really bad type of practitioner. Like, I always would tell people small problem, easy to fix, big problem, it's going to cost you a lot more time and money, harder to fix. It's the same with your brain health. So I'm very much into prevention type work. So that this is kind of in between that of getting to people before they're like Alzheimer's or dementia, trying to catch people in those stages prior where you're starting to glitch and your function, you're like, something's wrong, I don't know what's wrong. Your doctor just looks at you like you're nuts. So that's kind of like how I got into it. So long story, but
Yeah,
yeah,
pretty intense story though.
yes,
Being a chiropractor, being a practicing doctor, and
yes.
essentially having traumatic brain injury, right?
Yeah, the first couple of weeks, I actually was somebody who talked to my patients all the time when I put my hands on them. And the first few
Mhm.
weeks, I literally couldn't talk and work at the same time. My concussion was that bad, and I couldn't listen to music. And eventually things healed, but they just didn't heal 100%. And you get good at ignoring things for a while.
It kind of
Um,
becomes your new normal, right? Like,
right, right. And so going to the sports symposium was a godsend for me because it introduced me. One, it helped me, it fixed what residuals I was having. And
mhm.
two, it then opened my eyes to be able to help other people doing this as well. So,
Yeah. And
yeah,
concussion is so common.
it is.
My gosh,
It
so,
is.
so common. It's crazy and
Eh,
so
yeah,
just
yeah.
happen in a flash.
The number one cause of concussion is falls, and mine was a freak fall, like literally
How
stupid
did you
fall outside
feel?
my clinic. I was walking literally outside my clinic like I had done 100 times before, and I
Mhm.
guess I was walking at a slightly different angle, and my shoe caught a sidewalk that was raised, and
Mm.
instead of like throwing me this way, it literally basically slammed me to the ground, and basically my jaw and knee hit at the same time before I got my hands down. So, and what was interesting, I went to the ER and they're like, you don't have a concussion because you didn't black out. And in my brain damaged state, I looked at the MD and said, you don't have to black out to have a concussion because it's so. Anyway, I even when I was off kilter, like
Yeah,
I
yeah,
knew
you
that
knew
that
that.
was
You
wrong.
knew You
Yeah.
knew something
So
was wrong.
and that's the hard part is they're not trained in everything, right? And you
Right.
can't expect them to know everything. I don't know everything. So
Mhm.
but yeah, falls are the number one cause. And I've had plenty of patients who've had freak falls, not even sports, and end up with concussion. Car accidents are
Oh,
another one.
that's a
So
scary one.
yeah, and especially right now, it seems like people are driving crazier and crazier, at least in our
Oh,
area
yep,
anyway.
distracted. Yeah, I'd love to hear
So
from our audience. Anyone here, have you yourself had a concussion or any kind of traumatic brain injury or a family member? I have
yeah,
once,
yeah,
and it was a freak fall. I was in my
yeah,
backyard, you know,
yeah,
and I don't know, I think I was moving super fast as usual
yeah,
and the grass was wet and I just
yeah,
slipped and fell right and slammed the back of my head. And,
yeah,
I definitely had symptoms afterwards.
yeah,
Um, but yeah, they weren't too worried when I went and got a scan and all that. But anyway,
yeah,
I've certainly fallen skiing before. Thank goodness we wear helmets
right.
now. That was before
Yes,
the days of helmets, right?
yes, yes.
And even like really good skiers. Anyway, yeah, you need to wear a helmet.
You need to wear a helmet for skiing, biking,
Hiking.
rollerblading, even if you're on just wear the helmets for your
Yeah,
head.
even if you're really good at it.
Yes.
I know a friend who literally is an expert skier, runs the ski, is like
Yeah.
head honcho at the ski resort and, had a horrible ski crash
Yeah.
a few years ago. So anyway, all right, so let's get into the topic of the day, which
Okay.
is talking about blood sugar. So, nowadays of course we hear, blood sugar,
Yeah.
not, of course we know not great for that midsection adiposity,
Yeah.
right?
Yes.
So I
Yes.
think most of us have an awareness around that.
Yeah.
But can you explain the connection between sugar consumption and brain function? So that is not something that we typically ponder.
No. And so basically, it kind of like everybody understands how blood sugar, if it spikes, how you might feel kind of like, yucky and diabetics. Everybody understands the whole diabetic type thing.
Mhm.
But what people don't realize is, for one, your brain uses a ton of glucose. So it's 2% of your body weight. And I think it's like 18 to 20% it needs glucose, right? So it chews a lot of glucose. Um, and with that, your brain's very smart because if you're running low, it's going to tell you like, oh, I need some instant energy. I need some sugar. I need to get some, fuel in there. Um, but basically, if your blood sugar isn't stable and it's kind of dropping highs and lows, you don't even have to be a diabetic. You could be going like maybe it runs normal and your blood sugar's 100, but then you eat something, it spikes to 160 and then comes back down to 100. Now,
Yep.
you're not necessarily diabetic, but what those spikes do is it triggers inflammation in the brain. It affects your blood brain barrier. It affects the different structures in the brain, especially over time. So if it's a little bit, not so big a deal. But if you
Mhm.
have this subclinical level where your blood sugar is going up and down and you're not really that aware, over time, it's going to start creating longer term issues. So things that made people think about that are common, but they are a brain function issue, which is if you're getting mood swings. Well, that's because it's actually affecting how your brain's working. So
Mhm.
sugar causes mood swings, causes you to be anxious. People don't
Mhm.
understand that sometimes anxiety is associated with the sugar. So those are like, or you get fatigue, mental fatigue, mid part of
Mhm.
the day, later part of the day. That's actually associated with blood sugar. And all of those things are all pieces of how your brain is functioning. And I think people don't always think of it in those
Mhm.
terms necessarily, but it's actually a brain function issue. And it's what the sugar's doing to it.
Yeah, so I remember you telling me a story
Yeah.
about someone that you know
Yeah.
who was, experiencing panic attacks,
Yes.
right?
Yes.
Oh my God,
Yes.
that story really stuck with me. Can you
And her,
share, of
yeah.
course, without,
Yeah.
sharing any details, identifying details of the
No
person?
identifying details. Yeah.
Yeah.
In her case, she's a professional, medical health professional.
Okay.
And so she was describing panic attacks. Um, and I said, well, let's check. So I start with people's blood sugar for brain health because we have this rule. One of my mentors who teaches functional medicine always said that you have to fuel the brain before you activate the brain. So if your brain's not getting the proper fuel, it's not going to function correctly.
Mhm.
Say it's like a car. If you give your car bad fuel, it's going to start and stop and not really run correctly. So in her case, she was getting panic attacks. She couldn't figure it out. And I said, well, this sounds a bit like blood sugar regulation to me.
Mhm.
And she's fit. She's not overweight. She thought she had healthy nutrition and all that type of stuff. But in her case, she literally would get panic attacks random. And before she would get her panic attack, she would get some shakiness. And she didn't associate it with blood sugar. So I went through some tests and things like that, and I got her on a CGM. And it turns out in her case, she was hypoglycemic. And
Mm.
actually, what people don't, hypoglycemic is more associated with anxiety. So she was hypoglycemic, but she was also hyper. So she would spike, she would eat something, and her blood sugar was go to 180. And then
Mhm.
she would plummet like
Mhm.
very fast, all the way down to like 70 or 60. And so it was that big, like down and then back
Yeah.
up. And when she was low, she would start getting panic attacks. So
Uh,
because we had her on the CGM, she started to see the association between the panic attack and her low blood sugar. And then that also helped her to motivate her to want to fix the nutrition
mhm.
because she could see like those symptoms and the correlation between those two. So I know a lot of your audience are RDs. So,
Yeah.
trying to get people motivated to want to take action, the CGMs are great because then
Mhm.
they can see like, oh, these two things correlate. But yeah, she had no idea that her panic attack, she thought it was a mental health thing.
Oh my
And
gosh.
it was not like technically in her head, it was all blood sugar. And she's great. Like we're a couple years past and she's doing great. Like no more because she controls it. She now knows if she starts feeling it, she starts looking at her nutrition, like, oh, I gotta rein it in and be more careful. Yeah.
Okay. So I would imagine, case in point, get rid of sugar, right? For her
Well, yeah,
and other things like eating protein and
right.
things like
So,
that,
like, and what I tell people is, I mean, it's always like in moderation, right? So,
right?
I more worry about, and the research is starting to show more of this. I was looking this up before we started, but I want to make sure people's blood sugar spikes are more even,
Okay.
right? So like there's
So
not too many
levels, you're
ups,
not spiking
more
as
level.
high?
You don't want the high spikes, you don't want the low
Okay.
spikes.
Okay.
So ideally, optimal blood sugar levels, between 80 and 100. So if you eat something, you don't want to go up more than 20. You want it to come back to 20. So you have like this nice even keel as
Okay.
opposed to this, right? And a lot of times people don't know what it's doing unless they have some symptoms. And sometimes, even if they have symptoms, they don't put two and two together.
Right.
So I usually encourage people to kind of just look and get a sense of what their blood sugar is doing. And if you're getting nice, even spikes, great. Even if you're eating sugar, but you have protein in that, but you're still getting this nice, even kind of, you're doing okay, right? It's the people that are up and down, that's not good for. Yeah.
Mm. Okay. So interesting. Okay. So, um, I don't know if you have any more examples of maybe some surprising signs that people might be experiencing that are connected to blood sugar dysregulation, maybe specifically, related to brain health. Can you elaborate on that? Obviously, we talked about panic attacks. That's a really
Right.
good
So panic
example.
attacks, irritability,
Okay.
brain fog is in
Okay.
general related to blood sugar.
Mm.
I mean, brain fog has lots of causes, but uh, if you're getting mental fatigue later in the day, um, even if you've been eating and you think it's fine, it could be your blood sugar dropping. So then
Mhm,
you can't concentrate as well.
mhm,
Or your memory, the other thing that's directly related is memory function. So if you're glitching, a lot of people think, oh, it's because I'm getting older or I'm this or whatever. But the blood sugar dysregulation strongly affects your hippocampus, which is part of the area of the brain that controls memory function. So, like for diet, if you're diabetics, they show that their hippocampus starts shrinking pretty substantially because of the blood sugar dysregulation. But some of the research is also showing that if your blood sugar spiking, even if you're like in normal ranges, it's showing changes in that part of the brain. So your memory function, which then also is concentration, that type of thing. The other part of the brain that gets affected is amygdala, which is mood, right? So depression, some people don't associate
mhm.
depression with blood sugar, but basically, again, if that blood sugar is going up and down, it can affect that part of your brain, and if it's not controlled, it can make people very depressed. That could be their only symptom, but people don't put those two pieces together. And it does require, someone kind of working with you to figure out like those pieces, because again, some of this stuff has multiple causes. But what I start with is looking at the blood sugar because one, it's a pretty easy thing to start getting people to regulate. It's easy behavior changes, but you know what I mean? Like it's a easy, they can control it,
Yeah.
right? It's better than having to take a antidepressant type of thing.
Oh my gosh. It's a
S-
gift,
s-
right?
Right, right,
Be directed into the root cause versus throwing another
exactly.
prescription medication into the mix.
Right, which has some more of the side effects.
Mhm.
So those would be kind of more, there are symptoms people are aware of, but they don't necessarily associate it back to like brain health. If
Okay.
that answered your
Yeah, yeah,
question,
yeah.
I think. Okay.
So, yeah, it does. So one thing I wanna kind of
Yeah.
wrap my mind around is, no pun intended there,
Yeah.
is the concept okay, so what I'm taking away
Yeah.
is regardless of whether or not the person has, maybe some of these memory issues, brain fog, maybe some mood challenges,
Hmm.
anxiety, like your
Yeah.
friend or, the
Right.
person you know that
Panic
was having
attacks.
panic
Hmm.
attacks. Um, the approach sounds similar, at least with
Hmm.
blood sugar, as compared to someone with traumatic brain injury. Is that true? In terms of
Yes.
that first step, it sounds like that first step is let's
Well,
rein in the blood sugar. Am I correct there or not?
it's the first thing I look at.
Okay.
Yeah, so not everyone's going to have a blood sugar issue that
Okay.
has like a brain fog or brain health issue, but it is the first step I look at because if it's dysregulated and not working correctly, that means I'm not getting proper fuel to the brain,
Okay.
which means then the next couple steps aren't going to work very well. So if I start going to gut brain or brain gut access, if your brain is inflamed because your blood sugar piece isn't working, then me working on your gut axis isn't necessarily going to get you there. Um,
I see.
so it's that's kind of how I go towards it. I always check it with everybody because, again, there's a lot of changes you can make to get quick wins. You start getting the inflammation down. If you start controlling, if the blood sugar's going all over the place, your brain's on fire. And I
Okay.
have to get your brain like tamped down and kind of the fire out before I can start trying to activate your gut necessarily. Right. So,
Mhm.
and I think it just, but there are some people where I might say, like, okay, wait a minute, their sleep is so messed up. Like, because there's different pillars in this for me optimizing brain. And like, I'm like, okay, like maybe I start with two at the same time, right? But again, yes, people with traumatic brain injuries and concussions, they get glucose dysregulation also just from the trauma having the fall. They also get a gut issue, a gut access issue right away. So sometimes you combine them at the same time if the person can handle it. And that's the other piece. Like, depending on how much a person's brain is on fire depends on how much I can throw at them at the beginning. If that
Yeah,
answers,
yeah, it
yeah.
does. It does.
Okay.
Yeah. I
All
mean,
right.
I get it's highly personalized, so it really is going to depend.
Yes.
And I would imagine, I mean, people with traumatic brain injury, like their capacity to do some of these things
You have to go
is
really
probably
slow.
to be variable
Yes.
in
Yes.
terms of the, ability to actually implement. I mean, unless I suppose if they have, a family member or caretaker that is helping them in some situations.
Yes, depending on, again, there's a scale of like how intense a TBI is, from mild to, a lot of injury, but it is a piece of their journey for getting them
Mhm.
back on track. The nutrition piece, the, metabolic piece is hugely important because again, you have to get fuel to your brain in order for it to heal and function. Um, the other thing I was going to add that people don't associate with blood sugar and brain is insomnia. So, it's
Oh,
particularly waking up at 2 to 3 in the morning points a
mhm.
little bit more towards a hypoglycemic response. Your blood sugar's dropping and it
Okay.
ends up waking you up. Best way to figure those things out is actually through the sleep one is a CGM, so a continuous glucose monitor that's like on all the time.
Yeah.
We kind of help people do that, but sometimes people don't associate that waking up insomnia with the blood sugar
Mm.
dysregulation, but especially like in that 2 to 3 morning, that tends to point to blood sugars dropping, cortisol goes up, and then you wake up.
Oh, right. Okay.
Okay.
So, now I've heard this from people,
Yeah.
and this has happened to me as well. I'd
Okay.
love to hear if our audience has had this experience, but, wearing a CGM, I mean, I have like I turn my alarm off because
Yeah.
it'll just like keep going off all night.
Right.
Maybe not the best thing to do, but I guess my question is twofold. Number
Yeah.
one, is it really that is it super accurate in terms of the levels? Like, do we need to worry about it? And number two, if I'm consistently having insomnia, like waking up,
Mhm.
and
Right.
we attribute that to blood sugar dropping, what do we
Yeah.
do about it?
So good questions. Um, so if you're so hypoglycemia, you have to be really careful. So people who are true hypoglycemics, they have to have their alarm set to a certain level. Like I
Mhm.
think it's 55 or below is like a danger. So if you're a diabetic, you have to keep those that you should keep that alarm on. If you're someone who's just more like yourself and you're catching, yeah, those alarms, they can, depends on how you had them set. Like
Mhm.
I tell people to set them maybe a little lower, a little higher so they don't wake you
Okay.
up. Or if you know you don't have that issue, you can kind of turn the alarms off on that piece.
Yeah.
But if you're waking up all the time and you want to see if it's your blood sugar, then you would keep that alarm on. As
Mhm.
obnoxious as that is, because it's going to wake you up,
Uh-huh.
but it's knowledge, right?
Yeah, it is.
So you do want to have a sense of that. So what to do for so hypoglycemics are different than people who are they need more fuel more often, right? So
Mm.
they need to eat a little more and they need to be really good about their protein fats, but they need to eat more often.
Okay.
And in their case, they probably didn't get enough fuel before they went to bed so that
Okay.
their blood sugar started to drop. And that happened with my one client. That also happened. I had someone else that I've worked with who's hypoglycemic because they have cystic fibrosis. It's kind of
Mm.
a side effect of that along with the new drug, and they were having issues with waking up, and then they also had the panic attacks and everything also. So in their case we have them eat more of a healthy protein or fiber or some kind of healthy snack later in the evening. So that's inconsistent with the people who do intermittent fasting
Yeah, I
who
was gonna
stop like
bring that
three
up.
hours ahead. So like there's the people who are hyper, hypoglycemic, right, who go to 200, 300. I have one of those right now.
Okay.
Like, and that person, I'm like, don't eat after 6:30. And even with them not eating after 6:30, they're still going high in the middle of the night. They're going like
Interesting.
200, like so different issue.
Okay.
But the hypoglycemia, it's more dangerous if your blood sugar goes too low, that you
Right.
can run into danger. So you have to be careful if you're true hypoglycemic. So with those folks, I tell them to eat like closer to bedtime, but like a healthy snack. So like,
Okay.
Greek yogurt with some nut butter and something that's like longer lasting, stabilize the blood sugar through the evening.
Okay.
Um, so it's two very different types of approaches depending
Mhm.
on what's going on, which is why you have to kind of figure out like what the blood sugar is doing. You
Okay.
can't just say like, oh, everybody should do intermittent fasting,
Yeah.
right? Like, and that's the other thing. Like, I think a lot of people just don't really know where their blood sugar is at, right? Like, they don't know if there's an issue. So, if somebody's listening and they get mental fatigue, like crashes in the afternoon,
Mhm.
well, that's a chance that your blood sugar is not working. If it's not working, then it's not just stress, right? You kind of want to look at it and see what's happening there. Okay.
Okay.
Yeah.
That's so interesting. Um, so like someone who wants to do intermittent fasting, let's just say,
Yeah. Yeah.
relative, let's just hypothetical,
Yeah.
healthy, but they do get spikes. They're not
Hmm.
diabetic, but they do get spikes and crashes. Um,
Um,
what would you do with that person? Like, would you say, okay, skip the intermittent fasting, let's move that eating window to
so
allow
it
for a late.
depends.
Yeah,
How
okay,
how far are they crashing to? So if they're
I
crashing to
see.
dangerous, like, so like you can go from 160 to 100, and that's a pretty big spike. Wouldn't be okay for someone that. Or are you going to 160 down to 70? If you start going in that lower range, then I'm going to have a different approach about the
Okay,
intermittent fasting. Maybe so, and there's different
like
ways to do
below
intermittent.
70-ish, would you say?
Yeah, so if you're going below 70, you're starting to get in that hypoglycemic danger
Okay.
zone where I think, and if you're waking up at night, you're starting to have more crashes at night,
Mhm.
intermittent fasting may not be in your best interest, right?
Okay,
If you're, but there's different ways to do intermittent fasting, right? There's like the 12
exactly.
hours, they have the common one. And for brain health function, we recommend intermittent fasting a lot because it does help do a whole bunch of things for brain function behind the
Mhm.
scenes to give it a rest, to give your digestion a rest. Um, have that intermittent fasting. The research supports it. It helps clear out different things inside brain. Um, but like they talk about the 12-3 flex. So like you're 12 out, you eat in a 12-hour window. So like, if you're hyperglycemic or something, maybe you start eating at 7 in the morning, you go till 7 and you go to bed at 10, then you're stopping 3 hours before and see how that regulation works for you. And again, it's really individual. Like in general, somebody can take it, but if you're someone with hypoglycemia, I'm way more I have to be way more careful if you're
Okay,
dropping below 70 because that's a very dangerous area to get into for people. Some people going over 300, that's pretty dangerous too. But if
yeah,
you're kind of more in those middle ranges,
uh-huh.
you have more flexibility of what to
Okay,
do. Okay.
that
Yeah.
makes sense.
Yeah.
Okay.
So,
All right, I like that.
yeah.
I like how that makes a lot of sense. Okay. So let's talk a little bit then. I think we've talked about kind of the mechanism, right?
Yeah.
What happens in the brain and
Right.
how these, spikes and crashes create that inflammation,
Yeah.
brain on fire,
Brain
basically.
on fire.
Not
Yes.
good.
No, not good.
Not
Not good
good. We
at all.
wanna we wanna put a lid on
Right.
that. All right, so let's maybe talk a little bit about some of the long-term impacts of that,
So,
and the
okay.
impact on, cognitive function as
Right.
we age.
So I think one of the things people don't realize is people understand insulin resistance in the body,
Mm-hmm.
but you actually get insulin resistance in your brain as well. So I think most people don't realize that that's a thing. And if you're getting insulin resistance in your brain, what it means is when the glucose is coming in, your brain's not utilizing, it can't utilize the fuel.
Okay.
So then it creates this little vicious cycle of like you're going to get more fatigue and nothing's getting its proper function up there, right? As you get
Mhm.
insulin resistance. So that's over time, if you're spiking, and the research actually is showing like diabetics, so I'll go back a little bit. Diabetics have a huge increase in developing Alzheimer's to the point where they're calling Alzheimer's type 3 diabetes.
Mhm.
um, Higher incidence around. So, and that's because of the blood sugar dysregulation that's high. But within that, they're showing research that shows that blood sugar variability has more is more inclined to create dementia than just maybe high blood sugar variability is a higher impact. So if you're spiking a lot, those folks, they're showing the research is starting to point to that that's leading towards more dementia. Um, and dementia, Alzheimer's is just one form of dementia. Okay.
Okay.
So it kind of falls in that bucket. Um, so there's that piece. So you get the insulin resistance. So that goes back to why that would help start leading towards dementia. The other long term is chronic inflammation. And I think everybody understands in this group, particularly chronic inflammation causes all kinds of diseases, but brain function, brain health, diminished cognitive decline. If it's inflamed all the time, fuel's not getting work correctly, you're going to start having more and more issues. So you're going to start having more memory. And the research shows this. Diabetics actually have more memory function issues
Mhm.
over time.
Mhm.
People with more blood sugar variability, higher A1C, are having more and more memory cognitive deficits over time. So that's the long term. You have poorer circulation. So most people know with diabetes, they tend to get a lot of like peripheral circulation issues, but you also get decreased circulation to your brain function. So that can lead to vascular dementia, which is particularly debilitating. Um, and then it also leads to your mitochondria, so your little energy block's not working very well. So long term, it starts affecting all of those pieces of your brain. And typically, again, my goal is brain health optimization. So I really don't want people to end up in dementia, or do as much as we can to minimize that or extend, like if you're going to end up with it, like maybe it's way way down the line and not as early, if
Right.
that,
Postpone
right.
it for sure.
Yes, because postpone it or delay, because one, the impact on family, the
Ugh.
impact on your health, but the impact on the caregivers, people's ability. I've been in memory care units with family, with in-laws,
Mhm.
and I was fortunate. My in-law didn't end up there till they were about 101. It's pretty long, but they never ate sugar. I will tell you, this person like was
Uh,
so strict and didn't believe in sugar ever. They thought fruit was sweet. So firsthand, like yes, good genes, but this person worked it all their lives. Like they were so strict. I can't be that strict, but they
wow,
were
that's
super strict,
impressive.
which is impressive. But here's the thing for the ladies that are listening. Ladies get Alzheimer's 2 to 1 to men.
Oh,
Most of the research for Alzheimer's has been focused on men.
hmm.
So they don't really know why
Go
women are
figure.
getting, yes. So, and in the memory care unit that I was in,
Mhm.
it was predominantly women in there. I'd say probably 80% women, 20% men in the memory care floors. It's not a great life. So I would
Mm-mm.
like the ladies and men too, but I would like, us to not end up there,
Mhm.
right? So get it, genetics, all that, but the more you can do that you can control and kind of help yourself along the way, why not? Right? It's not a like, oh, I'm just gonna end up there because my mom did or my dad did. There's things that you can do and control. And that's kind of I want people to have that capability or understand that that's a possibility.
I love
So
that. So be
yeah.
proactive.
Be proactive.
That's
Yes,
really
exactly.
the name of the game.
doesn't have to be perfect, just, kind of
Yeah.
like get there,
Yeah, be
and
mindful, you
yes,
know, make good
yes,
choices as much as possible. Not
yes,
perfect, but yeah,
not perfect. Yes,
being
yes,
proactive, I think, is really where it's at. So speaking of which,
yes.
what are some maybe good practical solutions, to help people
Uh,
better regulate their blood sugar and protect their brains?
so I start with, well, do you even know where your blood sugar's at? Like, just anyone listening, have you even checked it? Have you even looked at it? Do you have any of these symptoms? And like, the number one symptom that clinically that I'll ask somebody is, do you experience any change in your energy or um, after you eat, or you function
Mhm,
after you eat? If you do, your blood sugar is not regulating correctly, because you're not supposed to. Normal should not like give you a lot of energy or make you fatigued, right?
okay,
So if you, number one, you should be no fatigue or changes in energy after you eat. So if you're getting fatigue or changes in energy after you eat, there's a potential blood sugar's off. So I would say see where you're at. And it doesn't have to be CGM. You can just get a glucose meter. Say you get fatigue, start checking your blood sugar levels like before you eat, and then 30 minutes and 90 minutes do I know not everybody likes doing the little pinprick glucose meter, but it is cheap. It's
mhm,
easy. You can do it at home. The CGMs now, it used to be very hard to get them, and now you can get them, but you could get one for sensors for a month and just start seeing
mhm,
what's happening to your blood glucose. I would say start there. That's first off.
okay,
If you don't want to go through all that, and you're getting changes in fatigue or energy, you could start playing with, okay, the standard of don't ever eat a carbohydrate without some kind of protein or fiber, right? Because
mhm,
again, to decrease blood sugar spiking, carbohydrates are going to, and even just plain piece of fruit is going to
mhm,
potentially start your blood sugar to spike. So, less so, but it can, depending on the person. I've seen people eat healthy food and have blood sugar spikes, which is something like an apple. So you could start doing, like, if you're getting these symptoms, you could start looking at what you're eating and go, okay, well, I ate a really high carb meal and now I feel like crap. Like I'm
mhm,
tired, I'm fatigued. So maybe next time, instead of, if I'm going to eat some carbs, let me make sure I have a fair amount of protein and some fiber to go with it. So
mhm,
you could kind of self journal. That's like the super low tech way of doing it yourself. But in general, the rules with blood sugar is, you typically, to even out the spikes, you want some fiber and you want some protein, you want some healthy fats.
mhm,
And I typically tell people, just don't eat carbs without something along with it. So
mhm.
if you want a piece of fruit, put some nuts with it. Just kind of make sure you have those combined pieces so that your blood sugar is getting even. But I personally think everyone should just check with the glucose meter or CGM and see where their foods are at, or see what's happening to their body first.
Okay,
Um, yeah,
I love that.
yeah.
And then what about like integrating movement after eating?
Oh, yeah.
Like,
Yeah.
okay, if I'm
So,
gonna go to eat
no, that's
Mexican,
good.
I know
Oh,
I'm gonna
so,
spike. So,
so there's two ways to do movement. So, I'm I'm trained in precision nutrition, which some people like. But one of the things that Dr. Berardi used to talk about all the time was, if you know you're going to eat carbs, exercise. Like if you're going to a party, or if you
yeah.
know you're going to get exercise in before,
Oh, okay.
so that you, when you eat that, it's going to burn better.
Okay.
um so if you're somebody who exercises and you like exercise, that
Mhm.
works. I have some people, like just recently I have someone that they say they just don't like to exercise,
Okay.
and I need them to move. So I'm like, okay, so the deal I got with them is just do a 2-minute walk
Yeah.
to the mailbox and back. So the research supports even doing a quick little movement after you eat
Yeah.
can help kind of get that regulation and the blood sugar spikes more level. So exercise is huge. And I tell people, like, if you eat something, do Vilpas. So little exercise snacks throughout the day. So if you're eating, do like 15 body weight squats at your desk or something right
Yeah,
after, or mix them up so that it does, the research supports movement, helps with blood sugar regulation as well. So the more you can do that, the better. I think the person yesterday, there's another person who said they didn't like exercise. And I'm like, well, do you like music? And they're like, yeah. I'm like, could you dance to a song at your desk?
great.
And they like that idea. So sometimes it's
Oh, I
just
love that.
trying to get them to do something better than
Mhm.
nothing. And your brain needs the circulation
Yeah,
to, yeah,
I love that. I mean, I can, say for me,
yeah,
I have since I started using a CGM, I've really become more
yeah,
aware of the positive impact of a
right.
little bit of movement after eating,
Yes,
right? It
yes,
helps
yeah,
so much. And
yeah,
I live in a cold place, so it's not like I really want to bundle up and like, you know what I mean? That
right.
is kind of rough sometimes,
Yeah,
like -12,
yes.
not happening.
No,
But
no.
I did get like a rebounder trampoline.
Okay.
Okay, now
Yeah,
I know like maybe that's not like the normal thing to do, but it really has helped,
but it's fun.
Instead
It's
of just
fun.
sitting on the couch, I'm like, "Okay." And I make a deal with myself, like,
Yeah,
"Okay, just do it for 2 minutes, and if you feel
right,
like doing more, you can if But,
right.
that has helped,
Yeah.
with the spikes because I am one of those people that kind of couple of corn
That
tortillas will it's not a pretty sight, let me tell you.
oh, yeah, for mine, I have to have protein with me all the time.
Yeah.
If I fast, actually, it's kind of weird. Mine is if I go too long and fast, my blood sugar starts spiking. So even though I'm not
Oh,
hypoglycemic, but what I learned with the CGM is that for some reason, for me, harder workouts and longer fasting seems to not be good for me. So I had to rein in the way I did intermittent fasting, and I wouldn't have learned that without like using the CGM to kind of figure
mhm,
that out. With the rebounder, if you like it and it's fun, it's like whatever works. That's why I was like, well, do you like to dance? Because, who
yeah.
doesn't, right? Like, so it's whatever you enjoy, because if it feels like a chore, you're not going to do it,
Oh my gosh,
right?
exactly.
I mean,
It's
I
like
spent 20,
well, and you don't
yeah,
wanna, like it should not feel like punishment
right,
because
right,
then, you're kinda
right.
walking that line of, punishing yourself for eating through
Yeah, and I want to
things that
get
you don't
people
wanna
away.
do.
Yeah, and I want to, and I'm not, and all of this, I'm not even worried about weight loss and things, even,
Mhm.
that can be a factor. It's more if you get this regulated and more even keel, then it's easier to do those other pieces. So,
I love that. Well,
yeah,
as we start to wrap up, I could
yeah.
talk to you all day about this topic. It
Thanks.
truly is
Yeah,
it's right up there in the top
yeah,
favorites of
yeah.
all time. Um, that said, do you have any kind of final words of wisdom that you would like to share? Any, maybe a first step for someone that is recognizing these symptoms in themselves,
Um,
their family member? What your
so
thoughts?
so standard like standard blood work for sure.
Okay,
You can get your regular blood work. Everyone gets fasting glucose tested, but I tell people to get fasting insulin tested along with that, which isn't standard. You have to ask for that. That is different than fasting glucose.
okay,
The A1C is important to a point, but fasting insulin is more important because it helps you. There's this, it's called an insulin resistant ratio. So you do fasting glucose time your fasting insulin. It's a special formula, but it tells you whether you're normal range, pre-diabetic, or headed towards diabetic range.
okay.
Um, and then, so
So
that
fasting insulin for sure.
fasting insulin for sure.
Okay.
That is a number one, along with your standard fasting glucose and A1C. It just gives you those pieces, but that is like the piece. And I guess just going back to figuring out where your blood glucose test is, you could do the more advanced test is an oral glucose tolerance test, which they'll do in the lab. But boy, I tell you, you're there for a while and they make you drink like sugar liquid at 30 minutes, 60 minutes, 90 minutes, and if you're crashing, you're going to feel really, really, really bad. but it is a pure test, and then they're actually testing your blood sugar in real time.
Okay.
So if you really want to like have the lab full on test, that is the way to go.
Okay.
So that would be the number one thing. And if you're having brain health issues, I mean, again, blood sugar is just one piece of this, right? That we look at. There's usually other components that go with that, but
Yeah,
um,
and you've got your 7-step brain health optimization
right.
process, right?
Right, right. So I kind of take people through, and again, like you said at the beginning, it's very personalized because every case is very different. I
Mhm.
take, we go through super extensive history. I ask probably way more questions, or as my husband likes to joke, I ask more questions than God. But so I take a really, really thorough history. And it's a key to figuring out what's going to work for that for each person individually. And I know it's the same thing, but I want people to figure out where their blood sugar is first. So start there.
Okay,
If you're
great.
good, great. If you're good and that's good, that's one thing you've checked off, right?
Okay.
And now you can go to, okay, what else could be affecting my function?
Okay. So what I'm doing right now
Yeah.
is I'm going to share your website with everybody.
Okay.
So,
Yes.
yeah, let me share that. I have it in a comment, but let me share it here.
Okay.
So, yeah,
Yeah.
anyone, if you want to get in touch with Dr.
Okay.
Kirsten, go ahead and visit her at dr drkirstengrove.com. Such a good name. I
Yeah.
love
Thank
that.
you.
You scored with the
But but then and just anyone listening, I'm one of these people that even though I practice in Virginia and I'm also licensed in Colorado, I'm more than happy to guide people to, like, if wherever you live, if you're looking for someone who does similar work, I love helping give people that information. So feel free to send me email any other questions that you wanted to, I'm happy to answer.
Oh, so grateful for that.
Yeah,
So yeah,
yeah,
reach out. And you have, I'm assuming I know your website, so you've got a
yeah.
form, a contact form there.
I have a
So
contact form there on the contact me, and I will look at it, and that's the easy way for me to get back to you. So
awesome. Okay,
yeah,
cool. So, and then before we wrap up, I just want to take a moment. I also shared this link, and this is so some of you may be aware, the last couple months I've been running well, actually last not couple months. I've been prepping for the last couple months, but like the last couple of weeks,
yeah,
I have the Freedom from the Grind Summit that I did in conjunction with Full Script. And we are wrapping up today. We've got a roundtable event with many of the guest experts. We're going to get together live on a Zoom call. So
nice.
excited. So we got a lot of good stuff in store, and that is happening today,
Yeah,
actually at the top of the hour. So that would be what, 1 o'clock? I'm on Mountain Time, 1 o'clock Mountain. What is
three
that?
o'clock
3 o'clock,
Eastern time.
3 o'clock
Eastern.
Eastern. I have to do all the
Yeah,
calculations. So basically in about 35 minutes.
yeah,
So I would love for you guys to join. I think it's going to be a lot of fun, and you are going to get an opportunity to ask questions to our expert panel. So here's the situation. You need to go to the URL that you see on the screen. It's just lesliebytel.com/FFTG-summit. So that stands for Freedom from the Grind, FFTG-summit. You do have to register for the summit, and then you'll be given the URL to join us for today's call. All right. If there's any confusion whatsoever, we are standing by. So you can drop us an email at lesliebytel.com. If there's any confusion about, oh my gosh, where's the Zoom link? I don't see it. Just drop us a line. But would really love to see you there. I think it'll be a lot of fun. At least I'm planning on having some fun myself. So, so please join me. All right. All right. So, and again, here's Dr. Kirsten's info. Check her work out. It's really she's done incredible work helping the world resolve these brain issues, everything from traumatic brain injury, brain fog, Alzheimer's, dementia, like all these things. So I'm so excited for your work and
Thank you.
really
Thanks.
delighted to see your progress as well. So thank you. And I do want to thank you for joining us today and sharing your pearls of wisdom with my audience.
Thank you for having me.
My pleasure. All right, guys. So we're going to go ahead and wrap up. Again, go to this URL. If you're not already registered for the summit, get yourself registered. The other thing is if you register, you will have access to all of these amazing interviews until the end of the month. So you have plenty of time to get yourself, at least listen to the interviews that look interesting to you. And then today, again, we're going to do the roundtable. We're going to meet on Zoom in a little, like about 30 minutes, essentially. So hope to see you there. All right, everybody. So I will talk to you soon. Thanks again, Dr. Kirsten. Really appreciate your time today. Hope you guys have a great rest of your day, and I'll see you next time. Bye for now.
Bye.
All right.